Dr. Rehana Sultana.
And I'm Anikat Ahmed.
We welcome you all to our webinar on how to stand out during PGY1 residency by Dream USMLE organization. Dream USMLE is dedicated to empowering IMGs, equipping them to fulfill their aspirations of practicing medicine in the United States. Dr. Abdullah Masood, Assistant Professor of Medicine, St. Louis University School of Medicine, is the founding director and faculty of Dream USMLE. With his guidance, Dream USMLE has witnessed countless success stories. Today, our goal remains the same, to provide you with the motivation and guidance you need to excel.
Before we start with our webinar, আমি Dream USMLE কে একটু introduce করতে চাচ্ছি and the support and the services that we provide to Bangladeshi international medical graduates. So the first thing everybody wants is to have a US medical career, and then we do provide comprehensive services for that. So it obviously starts with your USMLE steps. So Dream USMLE provides coaching or classes for USMLE Step 1, Step 2 CK, and also including OETs as well, and then all this paperwork and everything that you need for ECFMG certification. After once you're done with that, obviously your stress comes about residency application and everything. So Dream USMLE does provide training to applicants for residency interviews, step 3 preparation, and then definitely letter of recommendation gather করার জন্য. They do offers free observerships in top US hospitals. So that is something definitely to highlight. And we also have mentoring through global attendings, and these attendings are in various US hospitals, will help you during your residency application process. And throughout this entire thing, you will be able to form networking with everybody who's in your journey, who has been in your journey, and just like support each other. And this is like a very tight and united community, just helping each other together. That's just something to highlight. After that, we do have mental health and various different kinds of supports that you might need throughout your journey, because we do understand the journey that can be overwhelming, and sometimes people might go into depression and just doubt themselves. So we do offer services where we support you throughout the entire journey, and obviously you can talk to us and we have services for that. You can reach out to us as well for that. It's just something that just adds a bit of spice to everything. So I think that's kind of like the gist of what Dream USMLE does for the community.
Okay, so now we are going to start our webinar on how we can stand out during our PGY1 residency. And here we have Dr. Mushrin Malik, and she will provide us the valuable suggestions and advices. And she is the incoming chief resident of St. Barnabas Hospital. And Dr. Mushrin Malik, please take this platform and share your valuable suggestions and advices with the audience.
Thank you. Thank you so much, Rahana, and thank you, Anika. I will start with sharing my screen first. Okay. So firstly, I would want to congratulate you all for matching. This is a huge, huge achievement, and I'm so happy. Of course, you matched a few months back, but it's a huge, huge achievement to match and start your residency in a US program. So a big, big, big congratulations. I know just before you start your residency, there is a lot of anxiety. At least 2 years back when I started, I had a lot of questions. I was anxious. I used to feel like, oh my God, people will like, a lot of imposter syndrome, people will think I'm stupid. I don't know anything. A lot of negative thoughts used to come. But I really hope that with certain tips, which I share today. It helps you, in your residency, and it will guide you better. First, I would want to talk about some general tips. I think it's very basic. A lot of I'm sure many people have already told you about this: to be punctual, be professional, be team player, be proactive. It's basic things which everyone tells us, but I just want to dive a bit deep into this. In the sense of, when you say be punctual, be professional, I think all these things make you a good resident, in the sense, like, if there are, of course, every hospital has its own set of rules of punctuality of time. If you are supposed to come at a place at 6:45, um, you should try to be there at 6:45 or earlier, not late. And you should try to maintain that consistency throughout your residency. And it just shows that you respect you respect the time of everyone, like, because if you are coming in the morning, you're taking sign-offs from a morning team. If you're coming for a night float, you're taking sign-offs for a day team who has worked for 15 hours. You need to respect people's work and people's time. So, be punctual. When I say professional, every hospital has its own set of rules, own set of things which you need to follow, like, timely clocking in. There are certain modules which you need to finish when you are doing residency. There are certain, like, for example, we have to clock in our hours also in a website called Metrics. There are some small things which show if you are professional as well. All these things, like, I know, like, some of the things might you might not know from before, but most of the residency programs start taking orientation classes. At least, like, my residency program started taking orientation classes 3 or 4 months ahead of my starting date. So we had an idea of what things are and what are the requirements from us, what are the expectations from us. So whatever your senior or your chiefs are telling, like, this will affect your professionalism, you should follow it. You should not just take these things lightly, and it really affects, or it really shows that yeah, like, you are being you are actually a professional person who can be relied on. When I say a team player, it's it's very easy to say, and we, of course, everyone says it in their CV that we are a team player, but when you start residency, you will notice it so many times that there is a very sick patient, and you are running and you are doing everything, and then there is a resident who is sitting there in front of the computer saying, "Oh, this is not my patient," or a patient comes, our patient's family comes, and someone is asking for help, and, "Well, this is not my patient," and you're just like, "Okay, not my problem," and you just go on. Um, those are the times where, when you actually see if a person is a team player or not. There are times when you see your co-resident being overwhelmed with work. There's a lot of things. He has a sick patient today. He has multiple difficult situations to handle, and you just let that person be without even asking, "Okay, can I help you? Okay, do you need anything?" You go and tell your nurse, we need a stat lab. You just need to do it. Just this blood work needs to be done right now. And you don't even see how much work or how much overloaded this nurse is. And you just give the order and walk away. Um, I think those are the times when actual teamwork comes in show. When you are seeing someone is overworked, you can step up and say, "Okay, I will do it. I can specifically in a residency in New York, for example, I see that everyone is overworked. We are all understaffed, nurses, CNAs, doctors, everyone is understaffed. We're all overworked. And when you are seeing that, yeah, like, a nurse is busy, you can step up, do the blood work. If a patient actually needs the blood work right now, you are also a part of the healthcare team. You can do that for your patient. If a person needs an IV line right now, you can do it if you see that the nurse is busy. If your co-resident is very busy with something, and you are seeing, oh, a family member is, and there is a family member waiting to be spoken to, and he's getting upset about it, you can step up. You can ask your co-resident to, if you can help in certain things, and you can help your co-resident. All these are very basic things, but we forget about all these things because we get overwhelmed with our own work and our own life, and we don't do all these things. But it's so important, that I think these are the actual definitions of teamwork. You are not a team player only for your residents. You're also a team player for your entire health system, like your CNAs, your nurses, your clerks, your social workers, your pharmacists, everyone. You're a team, and your joint effort is to just make a patient stay in the hospital a good stay. And then, of course, be proactive. As I said, like, you're walking down a corridor, you're seeing a patient getting up, you see that there's a fall risk for this patient, and you still walk out and you just walk and do your own thing. And you're like, okay, there is a CNA to help him or help her. And you don't, or someone is asking, you see a patient calling for a nurse, and you're like, well, I'm not the nurse. Why will I go and see? But that patient is asking, maybe the nurse is busy and the patient is actually looking out, wanting help. You can go and ask I know a lot of times we are ourselves overwhelmed and busy, but if we do have the time, try to make those small efforts. All these small efforts are actually seen by people, and they really value you as a person. And it just makes your time during the residency a very beautiful time. And also, everyone who works with you have always really values you, really finds you like a good person to work with. And I think these are the basic things which I followed. And I was resident of the year as a PGY one. So my seniors usually always loved me. And thankfully, my interns same has loved me, being a senior, and I was chosen chief. I think these are basic things which I have followed. Nothing big. Just basics. So I would say everyone can follow this. It really helps. And then comes the basic, like the actual residency. So I know different people will start with different things. Some people will start in an inpatient setting. Some people will start in an outpatient setting. Some people might do ICU. Mostly, usually, residency are started with inpatient setting. So, of course, the first thing is to follow the general norm of your residency program. Every residency program usually is the same. So I will give you a general outline of how your day should look like. But again, every residency program has its own, rules and own flow. So usually the time is like 6:45 to 7 when you should come. For us, it's 6. We usually come at 6:45 a.m. in the morning, and we print our list and everything so that we can take sign-outs by 7 a.m. Usually that is how it is. By 7 a.m. we should take sign-outs from the night team. Once you have taken the sign-outs, you can do something called pre-rounds. So from 7 to 8:30, I would say you should go through all your patients, first do a quick chart review, and then go and see the patients at bedside, do a quick examination, focus examination, and then by 9 be ready to do the rounds with your attending. So, and then the attending comes, you round with them. Usually the round takes around 2 to 3 hours. You go through all the plans for each of the patients. You go and see all the patients again with the attending, and then once the rounds are over, you follow, like if someone needs to be discharged, you follow that. If someone a specialty needs to be consulted, you do that. All these things you need to, of course, do. And then we have a noon conference at 2 p.m. So we do the noon conference. And then after the noon conference, we have like another small round by the attendings who come and just see, like, get an update of what has been done throughout the day. And then by 4:30 we sign out to the short call team. Again, like the short, and then of course every hospital has its own call routines, but in the call you stay for another 4.5 hours, and follow the patients, do admissions and all that. So this is usually the basic norms. So while I would say that there are certain resources which are helpful while you are in the inpatient setting. For me, up to date, of course, is, I think everyone uses it, and it's of course very reliable. With if you are confused about a management of certain things, you can of course up to date that, and they usually give you a very good guideline of how to evaluate and manage that symptom or diagnosis. There is MKSAP. MKSAP is an thing from ACP. It helps you actually prepare for the boards, but it also has like general text which you can read on different symptoms, and it also helps you with evaluation of certain things. I really like John Hopkins modules. John Hopkins modules is something which I think every residency program has to do, and I really like their system, how they pick up every topic, and they, how, their entire course is very beautiful, very nicely set for me at least, because it comes with questions initially, then you do some questions, and then they teach you, you go through the course, and then again questions in the end. So I think the entire package, it really teaches you one topic very well. So that's why I really like John Hopkins modules. Then of course you can, while you were in the floors, you can use a pocketbook, which is from the MGH. So pocketbook, a lot of people use it because it has all the diagnosis and managements, how to evaluate, manage, very concisely written. One app which I use is PDR mobile app. I really like it because it has all medications. If you just search that medication, it will come with all the dosage, with all the indications and doses for that indication. It will come with dosing considerations, like how dosing consideration needs to be done for hepatic failure or renal failure, and what are the contraindications. So for all medications, it has all those things, and I find it very helpful when for certain medications, when they're not in the top of my head, for doses and considerations, or what dosage needs to be done for a particular indication. It's really helpful. I also think, like, of course, every residency program usually does an ACLS course before you start, but having an idea of all the ACLS, not only just a cardiac arrest, but basic things like tachycardia, bradycardia, strokes, I think it's a good thing to have in your head, so that when you are in the floor, if someone is tachycardic, what are the things to be done. So it just it's a small thing you should have in your head, and you should always follow. And then there are other things, like it's for you to study more, like for example, Landmark Trial is a website where there all the recent trials which have been done in every specialty, like cardiology, pulmonology, critical care. They have it very concisely written, the trials. So like what was how it was designed, the results, everything is very concisely written. So it's a good website to follow if you want to be up to date with trials. And NHEM Knowledge Plus is it's a subscription based thing. I don't have a subscription for it, but I have seen people, like in a group of people, if you're interested in learning more, you can take a subscription of this. And I liked the way it was written about each topic. So these are all like basic things which you can follow, which I feel will help you with understanding patients and symptoms and diagnoses better with their management. Just a quick thing, in inpatient setting, there are certain things like disposition of a patient, which is like for us, when we were, one thing which I found a bit confusing when I came to US was, there are multiple things. There are nursing home, there are patients who go to nursing home, there are patients who go to shelter, there are patients who go back home. I think those are certain things, and the social worker usually helps you with this. I did not include this in this slide is because I feel every hospital might have their own way of, how the social worker works with the patient. So I don't want to dive deep in it. But once you get into the hospital, you will have an idea of all those things. But, I just wanted to give you an idea that here, the disposition of the patient is different from Bangladesh. So, but it's something you learn through the process when you were in the hospital. And you should not be worried about it. There are seniors and everyone will help you. So just quick. Then after the inpatient, there are people who start with an outpatient base. So I started in an outpatient setting. I started in a clinic. And usually clinic is, again, like, every hospital and every clinic works differently, but a general thing is like you go, and then you have your own room in a clinic, and then you pick up a patient, and then you go through the patient's chart, then you call that patient in your room, and you go through all his symptoms, or all, usually in an outpatient setting, patient come for follow-up, and then there are some certain times when they have acute complaints, or sometimes it's a sick visit, but mostly they're for annual follow-up. So you go through their chronic conditions, like how their blood pressure is, how their diabetes is, if they're osteoporotic, um, if they're taking their medications, if they had a recent fracture, and then you also go through all their medications, see if there is if they're actually taking them, do a quick medication reconciliation, and then ask them if they have any right now any complaint, and then you have a clear idea of what this patient is coming with, and then you present it to the attending, and then you and attending have a plan, you follow the plan, and you discharge the patient from the clinic. That's basically how outpatient setting works. With basic things like hypertension, diabetes, there, of course, for hypertension, you have to follow like what medications they are taking, if it is controlled. For diabetes, you follow, the person's how the patient's A1C was, and then continue the medications or increase the dose. So it's basic, basic management of each conditions. But the other thing which is different in US is screening, which usually in Bangladesh we don't do. So of course every age has its own screening things, like screening for cancers, and also like preventative things like vaccinations. I think those are different here. So USPSTF has its own website, and you can find out like for each age what are the vaccinations which are recommended, what are the screenings which are recommended, and it really helps you have an idea of if a person, yes, a 56-year-old female comes in, what are the recommendations for her, or a 65-year-old female comes, what are the recommendations for her? So it's a bit different. So you need to know what are the recommendations. So it helps. John Hopkins modules, because again, like for symptoms like asthma or osteoporosis, what the things that are written in that module, I like it. I like to follow it because it's pretty well written. So I follow, so that's one thing. But that's how an outpatient setting works, I would say. And then there is some people might start with ICU, an interesting place to start with, but don't get overwhelmed. There's, of course, like a lot of things, specifically for me when I started, I used to get very overwhelmed. But it's nothing, just take one day at a time, and hopefully you will find you will find your place for yourself as well. Again, ICU has its own pace and own, it has, of course, critical patients. So it is like a general floor, but it has more critical patients. So you will have less patients for yourself, but all these patients have multiple system problems. They're on multiple drips. They have multiple lines. So you need to keep an eye on all those things, like if this patient is mechanically ventilated, what are the ventilator settings, what their blood gas is looking like, and then having an idea of what sedation is this person on, how much sedated this patient is and then what are the kind of drips this patient is on. Is he requiring any pressors? Is he requiring what kind of sedatives is going in the drip? And then what if the patient is hemodynamically stable, like what is the monitor looking like? Is there any problems in the telemetry? All these things. It's a more focused way of looking at each patient. uh, when we even present a patient in critical care setting, we present it system wise and not assessment wise. Like we go through neurology, then cardiology, then pulmonology. We go through each system and say, okay, this, neurologically, this patient is sedated. Of course, like right now, it seems like a lot of information, but when you go, like, as I said, like it's more system-based approach. It's more like every patient requires more attention, and you need to just have a great, comprehensive idea of all these patients. So it is a bit different, but I think some resources which are helpful is the Pocket ICU, and then the Marino's Little ICU book. And this ACLS also helps you in critical care setting as well. There's also a booklet of online medit, which I initially had it because that gives you an idea of how to present in ICU. That has also been a bit helpful. But again, like when you go to when you start working, give yourself time, and slowly you will, get adjusted to how the things are. I think I won't take longer. I will just say it. Oh, sorry. I have this one as well. So PGY 1 year is a 1 year. It's a year-long thing, right? You will be 1 year as a PGY 1. For 6 months, I will say dedicate yourself to learning the hospital and the system and what is going on, in the hospital. So, it takes some time. Don't get overwhelmed. I always used to tell myself this as well, that give yourself time, Mushin, give yourself time. Because, it's so easy for us to get overwhelmed and for us to just, get like blaming us or pushing us too much. You will, if you persistently work hard, you will learn the process. So don't be too harsh on yourself. If you don't know something, take it as a learning experience. If okay, I don't know this today, I will know it tomorrow, and have that positive attitude and just go on. Certain days can be very bad, very overwhelming. I did come back home crying because I was so overwhelmed with all the things, but then you have to put yourself up again and go the next day and just hope that okay, the next day gets better. But and it does get better, because all these experiences, all these don't knows becomes a no one day, and you in a matter of time you know so much. So just give yourself time, and you will want to take one day at a time, and you will do great. Okay. But as I said, the first 6 months is about learning at the hospital. But the next 6 months, I would say that try, if you are thinking of doing a fellowship, start doing researches or start being involved in building your CV towards that fellowship. Um, Of course, for research, you can use the NIS database and do retrospective studies. You can write case reports. You can do meta-analysis courses. You can do courses on the NIS database, um, research writing courses. And you can also get involved with other peers who are interested in the same fellowship. And you can jointly form a committee or community and start writing and getting published. Also, like, you can write abstracts and submit it to conferences. Conferences are a very good opportunity to meet mentors and actually make mentors, make connections. So I would say that, you should start working on that from the next 6 months. If you are not interested in fellowship, I can say you can start dedicating your time to start studying more. You can start studying for the boards, as well as you can do other things which might help you with your future as a hospitalist. Like, there is radiopedia courses. There, you can study more on EKGs. Things which will help you as a hospitalist as well. You can start doing those. So I would say this is a basic idea of how you can, curate your PGY 1 year. And I wish you all the best. If a person like me who graduated from a private medical school, not one of the top private medical school, a very mediocre private medical school, not having the best clinical experience, comes here and becomes a resident of the year or a chief in 2 years, is if I can do all this, I think everyone can. As I said, I'm not clinically very efficient. I'm not the smartest. I am my step scores are not the best, but if a person like me is doing this, everyone can. Just have faith on yourself, and best of luck. Thank you.
Thank you so much, Dr. Moshin, and congratulations of being Resident of the Year and Chief Resident. Um, some things I do want to highlight is that USA time punctuality is something that is very, like, it's a very subtle thing, but then that is something that's just, it's kind of like an insider thing. People are very aware of time, and then বাংলাদেশে যেরকম 7টা মানে 7:30, we kind of just make it like that and then we go, কারণ we expect everybody's going to be 30 minutes late. But then people are not like that here. People are very like, people value each other's time, and they are also, they expect other people to value their time as well, and this is kind of frowned upon when people are not punctual. So that is, thank you for highlighting that. Like, even though we kind of assume everybody knows this, but then sometimes we just kind of forget it. And yeah, and আরেকটা জিনিস is, yeah, definitely যখন interviews, one of the main things that residency programs want is a team player. Like, yeah, definitely your scores and all that, those things takes you to the interview, but then to nail the interview, everybody's like, are you a team player? Do you fit in our program? So definitely sometimes, yeah, there are going to be hard days, but it's about being there for each other instead of, being a little selfish and be like, okay, আমি আমারটা করবো and then সবারটা ওরা ওদেরটা দেখে নিবে. That's not what this is about. This is about helping each other and then caring for the patients at the end of the day. So that can only come when you're together. And those are the things that I do feel like, yeah, it was like definitely helpful. And thank you for sharing your tips and tricks for that. I do, like, I feel like that Bangladeshis have the ability, just residency match na, they also have the ability to excel compared to the fellow residents there. So it's all about persistence and dedication, as you said. So thank you for sharing your journey. That was very inspiring and humbling.